Carole Kane is in the prime of her life, 50 and fabulous.
No, I feel good and I go what appears to be 100 miles an hour.
But the mother of 5 says comments about the way she looks weren't so flattering.
You look so tired, you're so exhausted.
Genetics are to blame.
My mother needed eyelid surgery because it got so severe that it caused problems with her vision, and I didn't want to let it get to that. Plus I wanted just a refreshed look, so I'm kind of excited about that.
Well, relax, today's going to be real easy. Now today in office, just to review, we just took your photos, basically starting from the top down, 2 little access points in the hairline here and here that allow us to come down with little endoscopes.
But Carole wasn't excited about scheduling cosmetic surgery under general anesthesia. In fact, she admits the thought of an operating room frightened her.
I've had nausea with anesthetic.
Okay, we're going to go ahead and get started here. How are you feeling? You feeling okay? You drowsy enough? Good. All right. You're all numbed up now, so from this point forward, you're just going to feel me touch. You're not going to feel anything but a little bit of pressure. You comfortable? You feeling sleepy?
But Dr. Tim Gillum offers patients like Carole the option of having a facelift in the office. Carole chose to have a mini brow lift, upper and lower eyelid lift, and an in-style lift, a procedure Gillum coined to raise the jowl and neck.
I'm going to start with a little incision under this neckline here.
One of the big questions is I don't want to look overdone. I don't want to look like I got that windblown convertible look. However, when I get out of the car, the wind's still blowing, right? So the reality is, and kind of the hallmark of my practice is to just restore what has happened with time and gravity and genetics and give a very natural results.
These techniques can be performed under local sedation.
Go ahead and just keep your eyes closed, okay? Local and oral sedation has been done for some time, but over the last few years we've really developed a technique with the newer topical numbing creams that penetrate better, coupled with a nice little cocktail of oral sedation that really puts patients in a martini haze, if you will.
And that's actually what attracted me to it. I was trying to cut down on expense, and the idea of not having anesthesia and having to do it in an office setting seemed more pleasant for me.
And it's more pleasant for this surgeon.
From a surgeon standpoint, there's much less bleeding when the patient is in a awake, sedated state. The inhalational gases that you inhale during a general anesthetic causes small capillaries to dilate, which translates to more bleeding, which translates to more cautery, which translates to more bruising.
Gillum says with local sedation, patients recover faster with fewer side effects. Procedures can be performed during evening hours, and costs are 30 to 40% cheaper than general anesthesia. Although every surgery has risk, Gillum says in-style's risks are minimal.
Luckily for me and my specialty in facial plastic surgery, the head and neck is 10 times more vascular than the rest of the body. Therefore, infection is virtually non-existent, especially when coupled with a little preventative antibiotic.
It was similar to like when I had my wisdom teeth taken out. I came in, I took the medication. I honestly do not remember anything about the procedure until I was with my daughters getting ready to go home. There was not much swelling or bruising, and so there was not. I actually went back to work in like 8 or 9 days.
It's been 5 weeks since Carole Kane went under the knife. Take a look at her now.
I'm very happy. I am so happy. It's everything I had hoped for and more.
Carole's new look is motivating her to make lifestyle changes. She's dieting and exercising and plans to drop 65 pounds by her next birthday.
I wish I had done it before.